And welcome back to Talk of Alabama. As the weather continues to get warmer each day, we're praying. A lot of you are hitting the courts for a game of tennis, but it can be a sport that can certainly cause pain and injuries. Here to share more is Dr. Ricardo Colberg, who is a practicing physician at the new Pelham branch of Andrews Sports Medicine and Orthopedic Center. Welcome to you, sir.
Thank you, Nicole.
So a lot of people that I know, I don't play tennis, but a lot of my girlfriends do, and it's a pretty intense sport.
It is. You certainly have to be in the right condition to play tennis.
Okay.
I encourage a lot of people to stay active and play tennis. It's a sport that you can play. I have patients that come to my clinic, they're 75 years old, they're still playing tennis.
Yeah.
So it is a sport that does accommodate to the ages. But it is very important to stay fit, stay fit and be in shape for it.
Now, what are some common tennis injuries?
So we, at the Andrews Sports Medicine through the American Sports Medicine Institute, we recently completed a study on injuries of adult recreational tennis players.
Okay.
And we found that knees and elbows were the most common injuries. Now the interesting part of it is that we were looking at what were the causes of these injuries, why were athletes getting injured, and we saw that athletes that were playing less than twice a week, but were playing for more than 2 hours, were twice as likely to get injured than those that were playing on a regular basis every other day. So in other words, the typical weekend warrior, you work during the weekday and then Saturday comes and you try to play for 3 hours, they're twice as likely to get injured. And it's because the body's not conditioned to the sport. So it is important to stay in shape if you want to be active in the sport. And so, knees and elbows are the most common injuries that we see with this.
I was going to say, you hear about tennis elbow. Is that what you're talking about, or is that something else?
Tennis elbow is one of the injuries that happens to the elbow. It relates to inflammation of the tendons in the outside part of your elbow. Okay. And you can imagine you're holding a tennis racket all the time, and you're doing the forehand strokes, and you're doing the backhand, and those tendons they sustain a significant amount of strain when you're playing, especially if your biomechanics are not correct. If you're not a seasonal player and you don't have proper mechanics, you're at risk for sustaining tennis elbow injuries. The downside to the tennis elbow injury is that it's more of a chronic injury, something that develops throughout time, and they can be very hard to manage at times. You can do physical therapy and do anti-inflammatories, but they just won't get better. The good news is that at Andrews, we've introduced a procedure that has had 90% success rate in treating tennis elbow injuries. It's called platelet-rich plasma therapy, something that I do in the clinic. And basically, we use your own blood. From your blood, we extract the growth factors and the cells that have the healing potential in your body. And we get a concentrate that is 5 times more powerful than the regular growth factors in your body. And we inject it into the area where was the injury, and that stimulates the healing of the tendon. And again, patients have 90% success rate. So, it is something that if you've had tennis elbow and it's not getting better, you may want to consider this. Well,
in closing, I'm curious what we can do beyond trying to obviously get out there more often. What can you do to prevent injuries? Should you stretch? I mean, what should we be doing?
So the 3 main recommendations that we have in order to prevent injuries, one is to wear the proper gear. There's a certain degree of injuries to the ankle and feet because of wearing improper shoe wear.
Proper shoes.
So proper shoes, staying in shape, as we mentioned.
And as number 2. And
staying hydrated. The summer is coming. It's going to be really hot. You're going to be out there in the sun, so it is important to stay hydrated. Okay,
you're at the new office in Pelham. How can people get a hold of you if they've got more questions or if they simply want to learn more about some tennis injuries?
So I'm happy to see anyone. We're taking new patients. Phone number 205-939-3699. We also have a website, andrewscenters.com, and you can look up the information on our website.
andrewscenters.com for more information. So if you are a weekend warrior, he's basically telling you to stop doing that. Get out there every day and play, right?
Yes, yes.
Thank you, doctor, so much for being here.
Thank you, Nicole. Thank you for having me.
Very, very nice to see you.